Hello everybody, my name is Alan Henry, and for my CAM presentation topic, I chose humor therapy. For the learning objectives for this presentation, we're going to look at the history of humor therapy, rationale for humor therapy, uses for humor therapy, and the side effects of humor therapy. What is humor therapy? Humor therapy is the art of using humor, smiles, and laughter to help people with physical or mental illness during their healing process. Sometimes it may be referred to as therapeutic humor. Humor therapy helps you find ways to make yourself or others smile and laugh more. What is laughter? Making of the spontaneous sounds and movements of the face and body that are instinctive expressions of lovely amusement and sometimes also derision. Positive global mental state, unique to each individual, spanning aspects of cognition, emotion, behavior, and communication. It is typically associated with pleasant emotional state. The history of humor therapy. Ancient philosophers such as Aristotle, Plato, Descartes, Hobbes, Locke, Kant, and Darwin have considered humor and laughter to be a central phenomenon in the lives of people. Physicians have been advocating the curative aspects of humor for hundreds of years. Public interest in the health benefits of laughter developed in the 1960s, first used as a serious treatment with laughter yoga in 1996. Many nurses have learned the value of providing a good laugh to those they care for. Laughter appears to change brain chemistry and may boost the immune system. Rationale. Laughter is associated with multiple biochemical reactions in the body. It relaxes muscle tone, activation of sympathetic nervous system, decreases anxiety, and increases natural killer cell activity. It is known that 3 to 5 minutes of intense laughter can double the heart rate, the aerobic equivalent of 3 strenuous minutes on a rowing machine. Complementary role in reducing stress, anxiety, depression, pain, and improving immune system and cardiovascular epithelium. Humor workshops improve mental health and increase overall well-being. It increases social satisfaction, social integration, decreases negative and distorted thoughts, decreases depression, and increases physical health. It results in significant changes in state seriousness, satisfaction with life, and physical health. Humor may allow a person to feel in control of a situation and make it seem more manageable. It allows people to release fears, anger, and stress, all of which can harm the body over time. Humor is known to improve the quality of life. Here I'm going to play a short video explaining humor therapy and how laughter is good and benefits life.
Laughter is the best medicine. It's fun, it's easy, anyone can learn to laugh. We see laughter everywhere in all cultures, all people, all ages. Laughter is a great way to help yourself feel better. You cannot be depressed, anxious, or stressed when you're laughing. Laughter seems to have far-reaching health benefits. It gives your heart and your lungs a great workout. It dilates your blood vessels. It can lower your blood pressure. It may even protect you from heart disease. Did you ever notice how when you're stressed you feel like eating more? That's because stress drives up hormones like cortisol. And cortisol increases our appetite. Laughter reduces our stress hormones. In fact, a good laughter workout, 10 or 15 minutes of laughter, can burn about 50 calories. How great is that? Laughter also seems to help our immune systems. When we laugh, we produce more of the antibodies that protect us from infections like colds and flu. People who laugh a lot and find joy in their lives may find themselves also getting sick less often. If If you're someone who has chronic pain, you may not feel like laughing much. The good news, though, is that laughter can help reduce your pain. Laughter seems to increase the body's production of natural painkillers called endorphins. I sometimes will write a prescription for my patients, 30 minutes of funny videos every day. If you're going to reap the health benefits of laughter, you've got to laugh deeply and laugh a lot. How do you do that? Well, the good news is there's tons of resources out there. You can take laughter classes. There are even yoga classes now that focus on laughter. Or you can rent funny videos. Hang out with friends that you love to laugh with.
Don't laugh, Sarah. Don't laugh. Stop.
Let me leave you with some food for thought. Research shows that kids laugh 300 to 400 times a day. Not because they have some amazing sense of humor, but just because they're joyful. Adults, on the other hand, laugh about 12 to 15 times a day. So learn to take yourself less seriously. Find the joy in your life again. It's there, just waiting for you to find it.
I found that this was an important video to put in this presentation because it shows the benefits and how laughter can change the mood throughout the course of someone's day. Why commit to laughter? It cuts your stress levels in half, it promotes relaxation throughout the day, it gives you more energy, lowers blood pressure, results in social bonding with peers, fosters healthy relationships with others, makes you feel better, increases employment enjoyment, reduces interpersonal conflict, and laughter is a gift that keeps on giving. What can humor therapy treat? It can treat anxiety, mental illness, memory loss, stress, depression, chronic disease. Chronic diseases have a negative effect on mood and attitude, which can make the disease even worse. Humor therapy helps reduce the negative effects of feeling unhealthy, out of control, afraid, or helpless, which are common problems for those with a chronic disease. It can also be used as caregiver support. Humor therapy is also valuable as a preventative measure for the caregivers of people with chronic diseases. Caregivers are at high risk of becoming sick themselves, and humor therapy can help release the stress that comes from being a caregiver. Caregivers and those they care for can practice humor therapy together, and they both are likely to have better health as a result of this. Side effects. There are practically no side effects or contraindications really to humor therapy. Very rarely it can trigger an asthma attack. In some very rare cases, may cause abdominal hernias due to side-splitting laughter. A quick intake of breath may cause the inhalation of foreign bodies, and the possibility of becoming lightheaded may occur, especially if laughing while laying on their side. Contraindications. Laughter is universally well tolerated, but is ill-advised in patients with certain health conditions. People suffering from hemorrhoids, suffering from the bleeding tendencies in the body, people with acute cough symptoms, people with hernias, epilepsy, heart disease, angina, incontinence of urine, and uncontrolled high blood pressure. People who are pregnant may be advised to abstain from participating in this therapy to prevent any complications with their pregnancy. Patient education and considerations. For the patient selection, it could be with any patient who has conditions such as depression, anxiety, or mental illness, and then avoid patients with contraindications in the previous slide. Patient education. Teach about different benefits of humor therapy, what side effects may occur throughout the therapy treatment. An ongoing assessment, any specific side effects that someone may have, or possibility of more benefits because of this humor therapy. Cultural considerations. Virtually any and all cultures use humor therapy in the form of treatment. As long as the individual does not possess any of the contraindications, they are eligible to participate in this therapy. Nursing research study. There's a nursing research study called The Effect of Laughter Therapy on the Quality of Life of Nursing Home Residents. Performed back in 2015, there was an experimental group which was composed of 32 nursing home residents from one nursing home, while there was a control group of 33 residents from another nursing home in the capital city of Turkey. Laughter was applied to the experimental group 2 days a week for a total of 21 sessions. After the laughter therapy intervention, general and subscales of physical functioning, role physical, bodily pain, general health, vitality, social functioning, role emotional, and spiritual health, quality of life scores of residents in the experimental group significantly increased in comparison to the pretest scores. Laughter therapy improved the quality of life of nursing home residents. Therefore, nursing home management should integrate laughter therapy into healthcare, and laughter therapy should be provided as a routine nursing intervention. Here are a list of references, and I hope that you enjoyed this presentation today and will take humor therapy and trying to make your patients laugh while you're out there practicing as a nurse. Thank you so much.